So hello, everyone. Welcome to this month's AHA Team Training webinar. This webinar is a sneak peek to a session at the Advancing Care Conference, which we'll talk about more in a second here, on managing healthcare conflict using emotional intelligence to build safety culture. My name is Jen Braun, and I direct AHA's Team Training program. Welcome to our monthly webinar. So before we get started, just a few rules of engagement here. Oops, I need to request control. Sorry, one moment. Oh, there we go. Sorry about that. So this works nicely. So this is our second time using Zoom. This is our new webinar platform. So by now, most of you are hopefully familiar with Zoom, but if you aren't, just a few notes. You can access your audio in a couple different ways. You can either listen through your computer speakers if you have them, or through your phone, and you should be able to change that on your bottom toolbar. Again, if you're having any questions, feel free to chat them in. And speaking of the chat, just calling out that we will be doing a Q&A at the end. So if you have questions for our speaker, Santa, please chat them in. If they're more logistical by nature or technical, we'll answer that in real time. But if it's definitely more content-based for Santa, we'll save it for the end. And then just a note on Zoom, two things. One, the session is being recorded, and the chat will not be included in the recording. When you do utilize the chat, just a note that under the to section, you could either chat to everyone or you could chat just to hosts or panelists. So wanted to call that out. We're happy to offer CE credit for this webinar. In order to claim your CE credit, you must create a Duke OneLink account. They are the provider of our CEs. This Duke OneLink account is a one-time only setup. So if you've done it before, you'll never need to do it again. And my colleague Kara can chat in the instructions. And please refer to your email because the link's there. I can chat it in later as well. Following today's webinar, you're going to text those letters DEBKEC to the number there. You have to do this at the end of the webinar. And again, we will share this number and code again at the end. So don't worry if you haven't jotted it down. But again, Kara has included it in the chat as well. In terms of upcoming events, really excited. We're having our first in-person TeamSTEPPS Master Training course since the start of the pandemic next month in Chicago, March 6th through 7th. It's actually part of one of our pre-conference offerings at the Advancing Care Conference, but just note that you can sign up for the course only. You can certainly sign up for the conference as well, but if you just want to attend the course, you can certainly do that. And just wanted to note that there's only a few seats left. So really excited to be back in person. Our webinar speaker today, Santa, is actually facilitating a virtual workshop on managing conflict in healthcare starting at the end of April. It's a 4-week series. So if you like what you hear today, I really urge you to check that out and sign up there. And as always, we have our online community platform called Mighty Network. This is exclusive content. It's really a great way to connect with peers from across the country who are interested, not just in TeamSTEPPS, but team training in general. And then finally, our Advancing Care Conference is taking place next month in Chicago. It's right around the corner. If you're familiar with TeamSTEPPS or AHA team training, you'll notice a lot of those themes from previous conferences that we've done will be existing in the Advancing Care Conference surrounding team performance, quality and outcomes, resiliency and well-being, and education and facilitation. Registration is still open, and the conference is really aimed at those who get things done in healthcare, those situational or formal leaders that are working to improve patient safety and just the field of quality improvement. And so our speaker today, Santa Henninger, will also be speaking at the conference. So her webinar today is meant to be a bit of a sneak peek or a teaser as to what you can expect at the conference. So with that, I would like to introduce our speaker today, Santa Henninger. I've had the pleasure of getting to know her over the last few years virtually, as she's helped facilitate some of our virtual courses, our TeamSTEPPS for Change Leaders and Champions course. So we're excited to have her here today. So Santa, I will turn it over to you.
Wonderful. Thank you so much for having me, everyone, and for attending today. I really am passionate about this topic for a couple of reasons. One is my background's mental health. So I was a therapist for about 22 years and brought that passion and experience into healthcare. And so we certainly know the importance of relationships and resilience in healthcare as it relates to patient safety and our own well-being as well. I know it's been a really tough couple of years in healthcare. The pandemic has made it particularly difficult, and unfortunately, some relationships have suffered in healthcare as it relates to that stress and conflict. And so my hope today is that I can give you even just a couple of tips or tools for managing perhaps your own conflict, but also managing conflict around you. So I had a couple of things in mind with the objectives for today. One is I want you to think about conflict from the systemic perspective first. And if you were at any of my webinars a year ago, where I really started then was with the prevention. So as we think about conflict broadly, really the first thing that you want to do is be creating a psychologically safe environment that minimizes the likelihood of conflict or awkwardness or discomfort between people in healthcare. The next level to that is then the individual. And so as we think about systems first, we think about prevention. Then we may be thinking about how do we analyze the entire unit or clinic that you may be leading or working with, and then the individual. So the first webinar a year and a half ago was psychological safety. The second one a year ago was really looking at a broad way of creating an action plan for conflict management. And then today is really more about the individual. So that could be you thinking about your conflict with someone, but it could also be you as a leader thinking about how do I manage this conflict between these 2 or 3 people in the unit. So I just wanted you to, again, have perspective that today is a little more about the individual than it is about the full psychological safety of a particular area. So again, hoping to give you guys a couple of tools and tips for managing your own conflict or helping somebody else to manage conflict as well. Joint Commission certainly supports all that we do as it relates to TeamSTEPPS and teamwork. And we know, again, that is so important as it relates to patient safety. We also want to be thinking about the fact that conflict comes in so many different forms. So that conflict could be you having to say no to a colleague or even a boss for a project that you may be on, or perhaps you are working with a provider that sounds a little tough sometimes. Those are forms of conflict. So basically, we're just talking about discomforts between people. Speaking up certainly is another form of conflict. So conflict does not just mean we've had an argument in the hallway or we're struggling to have a conversation. It could mean any type of discomfort that you may have with others. And so where I wanted to take us today to start is the emotional intelligence model, which I certainly didn't write. There's many authors and books and research on the model of emotional intelligence. And I have just taken some of those basic concepts and match them to some of the healthcare types of conflict that I see so often and that we are so aware of. And so I will take us through just what emotional intelligence is. I think most of you probably know the model, and it is a really, really nice, simple tool for both evaluating your own participation in conflict. It is also an amazing tool for helping to coach somebody who is in a conflict situation and who perhaps has come to you for help. And then third, it is also a really good diagnostic tool for diagnosing the full team. And again, that's not the primary focus today, but as I'm thinking about and talking about emotional intelligence, you could certainly use this model, again, as sort of a diagnostic tool for thinking about your teams. And so I'll talk about how to do that today. First, I'm going to talk fairly quickly and go through the emotional intelligence model because I just want to get your head around that and have you really thinking about what it is, and then we'll talk about the application. So starting with emotional intelligence, and then again, we'll go into facilitating conversations, but starting with emotional intelligence, that is the first place that we have to go, or others have to go if we're coaching somebody else, is self-awareness. And it really has to be in this order. So if you're thinking about yourself and how you are managing a difficult relationship, and I hope you are right now, because I want you to be, I want you to leave in an hour with some true ideas of what you're going to do next. So if you're thinking about yourself first in a conflict situation that you may be having, you want to know not only how are you feeling, but you want to very clearly know what you are needing. So if you have ever been in a conversation or a relationship or even a conflict with someone, and you just leave scratching your head, you just don't know where they're coming from, you can't figure out what their point is, maybe even later on their behavior is not consistent with what they said, and you're just kind of racking your brain trying to get your arms around it. That is often because it is a person who, before they had the conversation with you, did not sit down and clearly determine kind of what they were feeling, what they were needing, what their own triggers may have been, and kind of weeded that out. They didn't do that. And so therefore, in conversations with others, they confuse people because they're not clear on where they're even coming from themselves. So also another problem with not being self-aware is not ever thinking you own anything. And so if you've ever known somebody who has been through 5 jobs in a year and says that every 5 of those bosses were terrible, or every team was terrible that they were on, and they just never own anything. That is, again, somebody who just doesn't have self-awareness. That's kind of the litmus test for a personality disorder. So that's something to think about if you are coaching somebody who tends to get into conflict a lot and just can't own it. You may just sort of think to yourself, it's that first quadrant, that self-awareness quadrant, where they really struggle, and where I need to stay in my coaching of someone before I try to help them with the right words that work in a conversation. Is get to this self-awareness. It's really got to happen first. Again, many different forms of how poor self-awareness can look: blaming other people, always making victim kinds of statements, being very reactionary, because again, they haven't thought through where they are, so they're not aware of triggers, so they may respond very strongly. I threw this in there. We're not going to take a long look at this, but just having been a therapist for 22 years, I remember that when people were of course, we asked people how they feel. It was very limited number of words that people used. And this is such a great tool. I just got it from Google, and it lists out the very fine-tuned nuances of feelings that people may have. Really good to know, because again, if you're about to have a conversation or you're in conflict with somebody and you yourself can't quite get your head around it, you may want to take a look at some actual feeling words to figure out where you are in this conflict. Good old defense mechanisms. There are some favorites. We like to deny. We like to displace our feelings onto other people. Oh, they were mean to me. Just get to know how people think, and this is a a list of some of the defense mechanisms that may help you understand kind of how someone ticks. And this is a great visual I found. It didn't have an author with it, so I just put Google Photos on there. But it's a great visual of a defense mechanism where somebody, doesn't want to show their own feelings, and so they yell at other people to not show their feelings. Again, just know your defense mechanism so that you have a way to evaluate other people. Greatest example probably ever of self-awareness is A Beautiful Mind. So if you have not seen that movie, I would encourage it. But in this movie, John Nash, a true story, actually was able to become self-aware of his mental illness and of his hallucinations, and that self-awareness is what allowed him to continue a beautiful life despite having the mental illness that he had. And it's just a beautiful story and the best example I could possibly think of self-awareness. Okay, self-management is the second quadrant. So we're sticking with the self. You probably know somebody, or somebody maybe you're coaching or trying to help, or maybe yourself, who says, yeah, I definitely know when I'm angry. There's no worry about being clear on that. I just kind of blow my top, and or I'm super abrupt, or I say things I didn't mean to say. That is somebody who perhaps they are super clear on their feelings, but they're not managing them very well. And certainly if we're not clear on our feelings, we're not going to manage them well at all, right? So if we don't even know we're angry, then something comes along and annoys us, and we're, kind of responding poorly. So self-awareness has to happen first. If you do have the self-awareness, but you don't have the self-management, then you're going to damage your relationships, and you're not going to get your point across the way that you want to. You're going to lose people, you're going to lose your message, and you certainly know people who may have this problem. So the reason for that is because when we are in conflict, our brain basically just thinks that we are in danger. And so it puts us in that fight or flight mode. And the behaviors that go with that are being passive and backing up and saying, I'm just not going to talk to that person, or being aggressive, right? And saying something that is harmful to somebody else. So that fight or flight does not give us the behaviors that we need to actually respond in a healthy way. So always thinking about that to yourself, figuring out a technique of some kind that works for you or the person you're coaching, that allows them a moment to think. And it will take practice and it will take time, but there are some good techniques. One is to start thinking about the 2 or 3 or 5 deep breaths before you speak. It takes people a long time to even be aware enough that they're about to say something wrong to do that. The way that you can build on that is help somebody or help yourself to revisit situations and conversations that they've been in that didn't go so well. So go back in time, sit there where you sat when you said something you didn't mean to say, and actually practice doing it differently. It just forces a new awareness, sort of a helicopter view of awareness of how we are feeling, and right before we're about to speak, giving us some kind of response as well. So the key is assertiveness. And this is a slide that I actually use very often with teams that I work with, in thinking about what is their tendency? Do you tend to be a little passive and kind of back up and not talk to people? Do you tend to get a little aggressive? Do you tend perhaps to get a little passive aggressive? And passive aggressive, of course, is the worst. That's when I'm not going to tell you why I'm frustrated with you, but I'm going to go talk about you, right? That's the passive, not going to speak to you, but I'm going to do something aggressive on the side. Assertiveness is really the only way you ever want to communicate. And again, in your coaching of other people, help them to think about this, help them to think about fight or flight, and help them to think about what assertiveness sounds like. And what assertiveness should sound like is that very matter-of-fact tone of voice where we could say, I'm really frustrated with you. In the same tone of voice that we might say, I love you, right? You can use the same tone of voice. So it's that matter of fact kind of language that we learn and use techniques of deep breathing or awareness to change our tone and our wording so that it is assertive, not passive, not little innuendos and being passive aggressive, or sharp and being aggressive. So your goals are stress coping, stress tolerance, finding lots of response options. I actually work with lots of healthcare workers on how to respond to challenging patients and to challenging coworkers. And what I encourage is take some time to actually write down the 3 to 5 scenarios that are hard for you with that coworker or with that patient, and sit down and with some of these tools that I'll give you in a little bit, actually write out what you might say, what you might do, when you might take the deep breath. If you actually sit and actively write it down, it is now a pathway in your brain that you are more likely to use in the moment. So the next time you're in the moment, it's not going to feel like you're so much in the moment when your brain has actually practiced it once or twice. So I encourage you, whatever conflict conversations you're having, write them down and write down a little formula for yourself on how you're going to respond ongoing. And then you don't have to every single time feel caught off guard. Okay, the next one is relationship awareness. So what happens is when we are in conflict, again, that is putting us into a feeling that we are in danger. And so when we are in danger, the only thing that's important is our safety. And we are seeking whatever needs to be done so that we are safe. We are and as that conflict increases, or as that anxiety increases, we become less and less interested in the other person's feelings, right? So if I'm super frustrated, somebody's really just made me mad, I'm not any longer thinking about, oh gosh, well, how do you feel, right? My feelings now are about, I'm backed in a corner, and so I need to do something to save myself. And that's why this part of emotional intelligence tends to dwindle as we are in conflict with others. So relationship awareness is actually very much a choice. It is very much something that needs to be practiced and remembered when we are in conflict. I very often speak to clinical staff in healthcare and kind of help them approach each other and speak up and ask questions, and they have to kind of help each other all day long. And what they often forget, understandably, given how busy all of you healthcare workers are, what we often forget is when we're working with each other all day, that we want to keep the relationship with the person in mind before we say anything else. So as you're walking down the hall, as you're about to approach somebody, think to yourself, what can I say first that has the relationship in mind before what I need to say or ask them? So as opposed to, I need you to sign this, how about, is this a good moment? I just need you to sign something, right? Some kind of first sentence or first moment that says, you as a person matter. Now I've got a question. So be thoughtful of, in your coaching with other people or yourself, that you actually have that in mind first, is preservation of the relationship. And sometimes you'll have somebody in conflict say, well, there is no preservation of this relationship. It's not good. They're impossible. And that's just not even anything worth thinking about. If somebody says that to me, I will encourage them to think about the fact that if they don't work to preserve or at least stabilize this relationship, it's going to hurt them in the long run. Then now they have to work in a relationship that is deteriorating or incredibly uncomfortable, as opposed to being aware and being interested in the relationship and keeping it stable. That just makes your life easier in the long run. So thinking about people's feelings, what they look like, and really paying attention. I think sometimes people, again, because of that fight or flight, we're just not paying attention. And don't take things at face value. Sometimes you'll have people say, oh yeah, no, we're good, everything's fine. But some gut feeling tells you maybe not. And then you may not want to pry or ask questions necessarily, but just take that as information that your gut feeling is saying something just doesn't match here. And we know when things don't match because your brain is very equipped at knowing when eye contact or the shape of the eye and the smile don't match. So if you've ever had a gut feeling about somebody, you were probably right. And you probably didn't know exactly why, but your brain's a little wiser than you are in knowing what facial expressions should look like. Also think about psychological safety for the other person. So as you're thinking about taking the deep breath and being aware of your feelings and being super clear on what your needs are, be thoughtful of where is the other person. And here is what I mean by that. What you don't want to do is you do not want to move somebody into a fight or flight feeling. You yourself don't want to be in a fight or flight feeling. And if you are, you want to pause for a minute and say, I'm getting really mad and I'm about to say something I don't want to say. And of course, I'm using the extreme example of conflict. Most conflict is not quite this intense, but really be thoughtful of, are you going into fight or flight? Meaning, are your coping skills starting to lead you to be a little bit passive? Or are you starting to back up so much that you're kind of out? At least be aware of that so that you can act with it. If you see somebody else who is going into fight or flight, pause and say to yourself, I need to do something right now to calm and settle the fight or flight response in this person. So here's your analogy. Your analogy is you are on a boat with this person, and the goal is that nobody sneaks off and jumps in the water and swims away. The goal is that nobody knocks the other person off the boat. And the goal is that the boat doesn't get so unsteady that both fall off. And the way that you do that is you think to yourself, this boat is starting to rock. I need to do something to calm this boat down. And the way that you calm the boat down in really intense conversations is you just say something like, you know what, I am so glad that we are just having this conversation. This is a really difficult topic. We have been dealing with this for years. I'm just so glad we've stuck with it, and we are still trying. Right? So things got a little tense. You say something that shows them we're frustrated, but we're connected. So there's your psychological safety. So getting better at being aware of others is start to look around, do some people watching, take a look at your team dynamics in meetings, who sits where, who asks questions, who talks to who doesn't talk to who. Start to really get used to being observant of dynamics that are going on. And the question is, what is really, really going on here? The best example that I could think of for sort of relationship awareness, others awareness, is Goodwill Hunting. So if you've not seen that, I encourage you to do so. But if you haven't, the example still is useful to you in that these are two guys who really were very aware of each other's problems and were sort of coaching them along, but completely not self-aware. So it's a very, very interesting dynamic. And in the end, they're in their helping the other to be self-aware, they become self-aware themselves. But a great example of relationship awareness. Okay, now getting to the relationship management. And this is including the relationship management kind of in the moment and long-term as well. So the ability to manage relationships long-term includes the ability, first of all, to be self-aware, number one, to manage your feelings well, number two, to be aware of the dynamics with other people around you is number three. Now we are at number four, And with all of that awareness and understanding, you are now able to adjust your responses based on all of that learning. You're mad, but you're clear on why you're mad. You understand they're very sensitive. And so you use these words to get your point across. So you are adjusting based on the three other quadrants of information that you're learning. There is a great book called Crucial Conversations, and I have no ties to them, but it's a good book that talks about conflict in healthcare, and it has some neat tools in there and some neat guidelines for conversations. But these words that work, that I'll show you on a couple of slides, these are basically the way that you are sort of settling that boat. You're decreasing the likelihood that somebody is going to kind of go into that fight or flight. Asking questions and showing interest, so the conversation is uncomfortable. So perhaps you say, you know what, I really want to understand what you're telling me a little bit better. Can I ask you a couple of questions just to make sure I fully understand your position? How nice is that? And it's make it genuine, of course, but it's also saying to the person at another level, I care about you as a person and a relationship. I respect you, and there is no need to jump off this boat or to knock me off the boat. So very, very easy technique to, again, sort of settle that boat. If you have somebody who is really inconsistent, you know that they're either not self-aware, or perhaps they're very self-aware, but they are just not able to manage. And so they're sort of saying things around the side of the bush. You can't quite get to what they mean, and you're confused, that kind of walking away, scratching your head. One thing that you can do is kind of put that inconsistency on the table. And you could say, you know, I know you say that you're fine with this, but then I've also noticed that you've spoken to so-and-so and we're really upset about it. So I just want to understand if I'm missing something, right? You can just kind of put the confusion out there on the table. And again, what a nice thing to do to care that much. Paraphrasing is a great tool. And then of course, priming the conversation. If you suspect somebody is, let's say you're a leader and you've got an employee that you've asked to speak with, and they're sitting there looking really uncomfortable, kind of prime what you think they may be concerned about. You know, do you think that we're meeting because you're in some sort of trouble? Just some great techniques there. This is another movie with a great example of kind of all around emotional intelligence, is We Are Marshall. And Matthew McConaughey, actually as a real person, not the actor in the movie, but as a real person, approached the town that was depicted in this movie and was absolutely so kind to them, and actually learned about every single person and incident and feeling that everybody had. And that was just really important to him. So I thought that was just an amazing example of emotional intelligence. Okay, so now we are going to talk a little bit about the kinds of conflict that we see in healthcare. And healthcare is really a unique environment for conflict. For one, healthcare tends to invite very passionate people who are really, really passionate about their work. They also tend to be specialists, right? We're all kind of specialists in our area. And then put that together, we are also supposed to work together. So we're specialists, we're intense, and we have to work together. Then add to it, we ask healthcare workers to, on the clock, run around and do these millions of tasks. You can't make a mistake. And then when there's a little run-in because of all that during the day, we don't have any time to debrief it and to say, you know what, I am so sorry. I was really rude to you earlier because I was so stressed out and I just did not mean to. I'm encouraging to make time for that, but healthcare in general, we just don't have the leisurely kind of time to have those kinds of conversations. So healthcare is really unique in its conflict and conflict management and the reasons that we have it and the difficulty with managing it. So several of you had posted some questions and thoughts about different kinds of conflict that you're experiencing. And here are a list here. A staff member or provider is chronically rude, or a group of employees maybe is unfriendly and not friendly towards another group of employees. This is conflict as well. A staff member that chronically complains and is bothering other staff members. Perhaps a significant emotional event occurs at the clinic that can create some intensity and tension. Excessive chronic change or stress, a relationship event that happens where others witnessed it. That's kind of a form of now tense conflict in the area. So those are some of the sources of conflict. I don't need to tell you that. You're here today because you have them on your mind anyway. So as I said in the beginning today is not so much about analyzing the large system. That was what I did earlier. That webinar is available to you. I'm still going to touch on that today, and then we'll talk a little bit about the models to help you think about your own conflict. So step number one, of course, if we're thinking at large system, is prevention. So I don't even have a slide in that, but that would be kind of the default. Always doing our best to create psychologically safe environments where conflict doesn't come up so much. If there becomes conflict, you have a unit or a clinical area where there is conflict, these two people, these three people, just perhaps the unit and the leader, there's conflict or tension there. All of these are so common. The goal is to fully understand it, and again, from a systems perspective. So before we even talk about how you might manage conflict with one other person or how you might coach two people in conflict, you do want to get up in the helicopter and take that broader view that we're not focusing on as much today. But you want to get up there, perhaps interview the team members, interview those who are involved, perhaps with some more specific questions. Always encourage kind of having a team approach. You want perhaps several leaders involved to make it unified and fair. Use similar questions. You could use TeamSTEPPS questions in that understanding. You could round on employees. You could use some team meeting techniques that perhaps are kind of fun to learn about the morale or the tension in the clinic. You could have them fill out cards anonymously. You could put people in groups with observed areas that you are aware are problems. You could create some mini surveys. We do that quite a lot. And then look at the comments or look at the questions that we've designed to get that beginning understanding of the larger conflict. And this is a document I put together and I just pulled from all of the safety culture surveys I've ever seen, all of the work culture surveys I've ever seen, all the kind of the team dynamic domains that I've seen through research, and just kind of put them all in one place here. And so today, of course, we're talking about emotional intelligence and conflict management. But you could certainly use this tool. What this has on here are several questions that you could ask yourself or along with your leadership team to better understand your clinical area. But we'll move on from this. I just want you to have them and see them and to understand, yes, you do want to first go to the larger picture. As I said in the beginning, the emotional intelligence model is just fabulous diagnostic tool for all kinds of things, and that includes your team. So you could really go back and think about all the quadrants that we covered and think about it for your team. So self-awareness, not just looking at myself now, but my team. Are they aware of their behaviors towards one another? How well do they manage their emotions as a team when change comes, right? And I, as a leader, am announcing change. Do they understand the needs of other people, or are they so siloed in their work? And then relationship management, are they able to put their needs and expressions into appropriate words? So you can, again, use it from a team perspective. And here are some more detailed questions that you could actually ask your sort of yourself or your team to understand. So now to coaching and or just thinking about your own conflict, certainly use all of the EQ concepts that we've talked about today. Make sure you are crystal clear on what you need, what you want, what you're feeling, what frustrated you. Be absolutely clear, and make sure that you're using good judgment, right? So were you a level 10 mad about something yesterday that now you realize, you know what, that probably wasn't quite right. It's probably more like a 5. So use your assessment, your judgment, your feelings, your thoughts, your events to get a crystal clear picture. Then use your skills to manage. And one of those big skills, as I said, is going to be prepare for conversations that you know are difficult for you. If you are coaching somebody, you're going to coach them to do all of that. You're going to prepare them for a facilitated conversation. So let's say you've got 2 people that you are helping to manage their conflict. Here are a couple of steps. Coach them individually to be self-aware. Coach them on that clarity. Coach them on understanding how they have contributed to the problem, right? Because we know that even if one person really is more difficult than another, or we feel like, gosh, they are so difficult, I'm doing my best, all of that may be true. You still may have some contribution. You may have become a little passive. You may have become a little bit aggressive. Your tendency may have come out. You just want to be aware, and you want to help your employees to be aware as well. Self-management, help them to predict. Sit down with them, talk to them about what the difficult scenarios are. What words will they say? What sentences? How could you actually perhaps help them to see the viewpoint and the concerns of the other person? Make a personal mission statement. Again, this is something you could do or you could coach, that you will not say such and such. I will not yell, right? Sometimes personal promises can really keep us on track. Create debriefing moments for yourself in your head. This is really helpful for coaching too, is helping people to learn how to pause and think about, where am I right now and what do I need to do a little bit differently? And then of course that relationship management long-term is the safety on the boat, is when things become unsafe, how do you find sentences that can calm and tame either yourself or the other person? So here is a model. The Connect, Care, Close model is one that we are now using at Duke, and we built it a couple of years ago, and that was originally based on how we communicate with patients, and it has now evolved, or I'm evolving it into how would we use it with each other. So the first thing we want to remember when we are dealing with human beings is that human beings do not do very well with being dismissed, being overlooked, being undermined, being uncared about, not seen, neglected. All of those words have a very similar common denominator. And if you think about little babies, when they don't have any other communication techniques other than to cry loudly, which is part of their survival so that we come running, they are not only looking for you to come and get them warm or get them some food. They are actually responding to an initial internal question that asks, is there anybody out there? Right? So there's that initial learning that we have to know whether or not somebody is actually out there for me, right? And then the next phase of life is the 2-year-old who has lots of feelings of anger, really wants control, doesn't have the greatest coping skills, doesn't have the greatest communication techniques. And so they, are known for throwing temper tantrums. What the 2-year-old really needs and wants is to be heard and to have some kind of control. If you can remember those 2 stages of life, you will have a better sense of how to handle a conflict conversation. And the reason I say that is because those questions of, is there anybody out there for me? Do you hear me? Do I have any control here? Those questions really return to us very frequently, particularly when we are tired, when we have poor coping skills. Perhaps when you have threatened me in conflict and now I'm feeling backed up against a wall. When I'm feeling backed up against a wall and scared, I want to know, okay, wait a second. Do you even care? Do I have any control here to get out of this corner? And are you listening? So if you think about anybody who's ever been frustrated and who has been loud, think about the feeling of anger. Anger is loud and long because people want to be heard. So having said all that little bitty psychology class, the Connect, Care, Close model speaks to that, and particularly with difficult conversations. In your connection, the beginning of the conversation with somebody, you want to let them know with your words and your demeanor that they matter. That has to be first. So I said that before, even talking with clinical staff as they approach each other with questions or needing help. Whatever conflict situation you are considering, and you're trying to put some words together for how you're going to approach this, many different techniques here written here, but the goal is start with how they matter to you in whatever words that might be. It might be, gosh, we have worked together for so many years and we have been through some really hard times. I am just glad we are able to have these really difficult conversations because you are very important to me. That'd be an excellent first sentence to a conversation that may be perhaps really difficult. So you can see some techniques written here. You can have this handout. I hope that will be helpful for you. But basically, the nonverbals, the nod, the use a furthering style, the paraphrasing, the asking for clarity, as I said before, all of that tells that sort of infantile part of that person that they matter. The second is showing them that you care by showing them that you hear them. So again, somebody who's a little frustrated, some tension in there, again, they want to know you care at all, and they want to know that you at least know their story. Even if you don't agree with it, perhaps, they want to be heard, right? You want to be heard. People want to be heard. And so the easy techniques there are simply to say, listen, I just want to clarify something, or can I paraphrase what I think you have said so that I make sure I understand it? Because I want to make sure I understand you before I sort of share my concerns, right? What a wonderful thing to say. And basically what you're saying is you're tapping into that part of them that's listening for, did you hear me? And then third is the sense of control. Like, what are we going to do next? And do I have any options here? All of this is excellent for communicating with patients as well. But let's make a plan. So what are the next steps that we will do? What will you do for me? Here's what I will do for you, right? That's kind of your best next steps and plan. So this is just a wonderful model that kind of fits the psychology of people and people who might be frustrated. So again, you matter, I hear you. Here's some control we both have over making a plan in the Connect, Care, Close model. Here are some other words that you can use. We won't go over all of these because I've shared a few of them with you already, but here are some more that you could take a look at some point and really kind of think through. In my own self-awareness, am I showing respect? Am I paraphrasing? Am I showing them that I care? So your self-awareness is going to take you to that Connect, Care, Close model and say, am I doing these things? And if not, what kind of techniques, such as right here, might I need to use to make sure that I am doing that well? Here is a template that pulls together questions that you could ask yourself in all of the quadrants. This is also excellent for you to give to employees that you might be coaching, particularly if you're going to be meeting with two people to try to resolve that conflict, or perhaps even a team. So as you meet with people, kind of establish a goal, start with psychological safety, have a good introduction, have people share their perspectives from their worksheet. So again, I encourage you to give them this worksheet in advance and say, I'd like for you to look over this worksheet and have some answers to it. I'm going to meet with you once to talk about what your perspectives are, and then we're going to meet together, the three of us. This is, again, also excellent just for you yourself to think about. As you're meeting with somebody, again, make sure that opening is good, create a comfortable opening, sort of compliment both of them for their strengths and for being here today, offer a summary of that purpose. And then probably the two most important things, or three most important things, are that you write down needs and goals on paper for each, that you have each of them accept a personal assignment for contributing to the solution, and then make sure you schedule the next meeting before you leave. And the reason you want to do that is because often people will come out of sort of these conflict negotiated conversations and feel really uncomfortable, or let's say it's even you having had a perhaps uncomfortable conversation with somebody. Schedule the next time you meet, because otherwise it feels like, okay, so we met, kind of some good came out of it, I'm not too sure. And then we throw people back out in the ocean and it gets really uncomfortable. Particular people who kind of work near each other, there's just kind of this uncertainty. And so you want to say, great, so we've established a few goals for each of you personally, and here's what we're going to do next. We're going to meet next Monday and we're going to talk about this. People just leave feeling so much better and more solid. This is the post-conflict worksheet. You could use it for yourself. You could use it with staff that you might be coaching. What did I learn about myself today from a self-awareness standpoint? How could I better manage my emotions next time? Relationship awareness. What did I learn about others' needs that I hadn't even realized? In relationship management, what do I need to do differently to get my needs met? What can I do to show this person respect? And what action items did we decide on today? So this could be the post-conflict worksheet you use either for yourself or you use in your coaching situation as you meet with people again. So the next step then is to do it again, kind of do that whole process again. You may round on them. My point here is stick with it for a little bit, because conflict and sort of run-ins and discomfort with people, we know, does not just sail away. It sticks around for a while, and it takes a while for people to get comfortable and build trust. And sometimes trust can't even be built. It's more about how do we just stabilize this relationship so people can be comfortable and enjoy their jobs. So in closing, I'm going to show you some slides that are actually from the psychological safety webinar that I did a year and a half ago that is available to you. But this is going back to kind of the larger plan, which was not the focus of today, but just wanted you to see, because it's hard to talk about just conflict by itself without kind of talking about the bigger picture as well. But this is an example here of using the emotional intelligence for teams. It's got the questions listed here. It's got an example in the middle. And then on the right, it's got some of the best techniques that I would recommend. And some of them are ones that I made up, but they're good. I promise you that. And so they are here in the next couple of slides. Some of you have seen them before. I will be talking about these in the upcoming webinars that Jennifer talked about in the opening. And so I just wanted you to see these are here. One is conflict management, making sure that you are clear with your team on how conflict is going to be organized in your clinic. Another one is team values. And sometimes team values are really just about, you know, we will ask each other for help as needed. It could be more serious. It will be, we will say good morning when we say good morning to each other, right? I've had teams that just aren't even speaking to each other. But you also want to make sure it has a conflict management value in there. And I would be happy to share kind of how to run that type of meeting. This is another excellent tool. With what I call the 3 magic questions, and they're just my 3 magic questions, but they're very effective. I've used them in conferences with 300 people. I've used them with 3 people. But basically the 3 questions are, what do I predict is needed from me or from us? Right, so if I'm a profession and I'm thinking about, I'm a clinical staff member, I'm thinking about, what can I predict the providers need from us? The next question is, what do we need from them? And the third question is, what do we appreciate? 3 magic questions you could use just with yourself and one other person, or you could use it with a larger group. Cross-understanding activities, I talked about that, making sure people understand the stressors of the other profession. All of this builds psychological safety. Getting team values around helpfulness, having people really understand psychological safety, encouraging personal self-reflection moments as opposed to, were there any safety events or was anybody speaking psychologically unsafe this week? It would be much better to say, does anybody want to apologize for a behavior that they didn't quite mean? Again, more words for asking questions and speaking up. And then we end again on the emotional intelligence model. So I hope that that was a helpful start to think about words that you might use, ways to identify kind of where you are, some techniques for self-management, how to be have a relationship awareness, and overall how to manage conflict. A little bit we talked about from the systems level, a little bit of prevention, but then mostly today we talked about how do you actively prepare for a conversation or prepare to negotiate a conversation between two other people. And so I will close on that. It's about 5 minutes till, and just wanted to give Jennifer a moment to talk, or if there were any questions that can be answered quickly, that's great. And otherwise, please reach out to me, and I would love to answer any questions that you might have.
Thanks, Anna. That was a lot of great information. If you could either give me control or advance. Oh, I can advance. I got it. I just want to do a few announcements just while I still have everyone's attention here. Yes, you will receive the slides. They were sent to you this morning. They were included in the chat. If you had any issues accessing them, we will share with you by the end of the week. We will also notify you when this recording is available on our website. So we'll take care of that. A few other housekeeping items. Santa referred to a few of her other webinars she's done for us. So we will also send the link to those, again, slides and recording from our webinar resource library. So great tools there. Finally, I'm looking at my notes here. After this webinar is over, your browser will appear with an evaluation form. So we really value your feedback, so please fill that out. And then finally, you can text the code there in red to the number you see on your screen starting in 3 minutes. So I will leave this up, and I'm going to ask Santa just a couple of questions to close out the session that have been chatted in. So Santa, we might have time for one or two.
Yeah.
So one of the questions earlier on in the presentation from Jennifer asked was, how do you make sure your emails are not toned incorrectly?
Oh, very good question. My answer to that would be about the connect, care, close model. When I was saying connection has to come first, make your first sentence really good. Make it about the person, and it might be a good idea to even have it unrelated to what you're about to say. So you might say, gosh, it is snowing out there. I sure hope you got to work safely, or that you're home. You know, just something. I completely made that up, but have that first sentence be a good one, because that sets the tone for the rest of the email. And then read your email before you send it. That would be it. Have a great ending, and say, I sure hope you have a good day. I know this has been a tough project. Something like that, that shows, again, I'm connected to you.
Yeah, that's a great point. Someone in the chat actually chimed in and said that they read it out loud before they send it too.
Very good.
So that was good. Thanks for that. Okay, last question. I'm just gonna think here. What would you say if the attempt to quote unquote calm the boat during a conflict is not received by that other person? What would be the next steps?
So one thing I will tell you, that there will be conflicts, and there will be people where you are going to do everything right. And it's really, you're going to think to yourself, it's never going to work. And you might actually be right. Sometimes they're just people who really, really, really struggle. So my first is to say, don't feel like a failure. If you kind of feel like you do everything right and it just doesn't work, feel okay with yourself. In that moment, though, I would either do it again, maybe 2 more times, 2 more psychologically safe sentences. And then you may have to, at some point, kind of decide what can I control about this relationship and what can I not? And then prepare that for your next conversation that you have with somebody. It might be some long-term thinking that needs to happen in there.
Great. Well, we're just at the top of the hour almost, so I just want to take a moment and conclude and say thank you so much, Santa. You've gotten great feedback here so far in the chat. It's been blowing up this whole time. Again, for those that are interested in hearing more from Santa, we'll be sharing some pre-recorded webinars, and there's opportunities to meet her in person at the Advancing Care Conference and or participate in her virtual workshop series. So with that, I'm going to end the webinar, and I hope you all have a great rest of your day.
Thank you.